myocardial infarction, congestive heart failure, cardiogenic shock. Myocardial infarction. Key points. Disturbance of blood supply to the myocardium. Contributing factors include arteriosclerosis, thrombus, emboli, hemorrhage. The heart becomes necrotic if blood circulation is not rapidly restored. Vasodilation can occur due to hypoxia from ischemia. The client can fall into cardiogenic shock due to acidosis, which is linked with electrolyte imbalances. The left ventricle is the most frequent site for a myocardial infarction. Signs and symptoms. Substernal pain/precordium pain for longer than 15 minutes. Heavy pain down the left arm. Heavy pain in the neck and jaw. Shortness of breath. Dizziness. Nausea. Vomiting. Fall in blood pressure. Rise in heart rate. Rise in respiratory rate. Diagnosis. Monitoring of the ECG and cardiac profile consisting of cardiac enzymes. Monitoring of white blood cell count, blood urea nitrogen, and sedimentations rate are other useful tests that can offer a better analysis of the condition that the client is in. Serum enzymes used to make a diagnosis. Creatine kinase, CKMB, CRP and LDH, troponin T and 1. CKMB increases quickly when there is a disturbance with the myocardium. Troponin T and 1 are utilized to measure the magnitude of the attack. They can be elevated for up to 2 weeks after a myocardium attack. Management and treatment. Monitoring blood pressure. Monitoring oxygen levels. Monitoring pulmonary artery wedge pressures. Dopamine for rapid fall in blood pressure. Pain relief medications such as morphine sulfate IV. Medications to vasodilate the coronary vessels. Thrombolytics, e.g. streptokinase. Small and regular meals, low in fat, sodium, and cholesterol. Fluid and fiber to avoid constipation. Post-myocardial infarction. Regular exercise. Cessation of smoking. Limited caffeine intake. Sexual activity can be resumed in 6 weeks. Medications clients will generally be discharged on. Aspirin, enoxaparin, Lovenox, clopidogrel, Plavix. Exercise electrocardiography. Assists in determining the heart's functioning during exercise. Prior to the test, the client must only eat a light meal and not smoke or consume caffeine. 1. The client is firstly given an ECG assessment. 2. The client engages in light exercise, such as walking on a treadmill. 3. The client is asked to inform the cardiologist of any chest pain or breath shortness. 4. The client continues until either the maintenance of a rapid heart rate is reached, any signs of abnormalities are seen on the ECG, or ST depressions are noted on the ECG. The client stays in the unit for up to 2 hours following the test to make sure there are no indications of hypotension or cardiac dysrhythmias. Echocardiography. A non-invasive test to determine the ventricle size, valve functionality, and heart size. The test generally takes 30 to 60 minutes. A more invasive method is transesophageal echocardiography, which assesses the structures of the heart. Cardiac catheterization. Used to discover blockages that are linked with myocardial infarctions. Requires signed consent. The nurse should assess client's allergies to iodine or shellfish, assess renal function, ensure the client is on a bed rest for up to 8 hours after the procedure, ensure pressure is kept on the access site for 5 minutes following the procedure.